I am New York.
Ya some New York.
I am New York.
Yo soy Nueva York.
Sono New York.
Je suis New York.
Welcome to DiverseCITY, where we explore New York's eclectic enclaves, one neighborhood at a time. I'm Zyphus Lebron. This month we're heading to Roosevelt Island, the 800-foot wide, 2-mile-long sliver of land off of Manhattan's east coast. The island is technically part of the city, but only accessible via car through Queens. The industrialist Frederick W. Richmond originally envisioned the island as a car-free community. By the time construction began in the early 1970s, the urban utopia was supposed to be a cheaper, quieter alternative to Manhattan that would bring together people of different racial and socioeconomic backgrounds. It started off as affordable, but over the last 15 to 20 years, the developers, the Hudson companies, and related companies have built more residential, rental, and condo units and added more retail space along Main Street. Cornell's Tech campus opened here in 2017. The campus is now home to the 224-room Graduate Hotel. The island's also become a preferred rental spot for United Nations employees coming from just across the river. All this has caused an uptick in property values as more people seek the quiet of the island and the convenience of being close to the city. Now, more than 16,000 people call the island home, according to population estimates, more than half of whom are Black or African American, 40% Latino, with the rest identifying as white and Asian. On this episode, the Kohler crisis, outrage over the city's actions that allegedly caused patients at a local facility to become infected with the coronavirus. Harrowing history, nightmarish tales from the island's past, and the reminders that still stand. And pneumatic for the people, a futuristic form of trash disposal that's still ahead of the curve. Those stories and more coming up as we explore Roosevelt Island. A city-run long-term care center has been a hotbed of controversy throughout the pandemic. This after the de Blasio administration allegedly transferred COVID-19 patients into a wing of the facility with healthy residents. As we hear in this report from Shannon Ayala, advocates are working hard to hold someone accountable for the deaths that ensued.
It was very pleasant to live here.
Jay Molina has been living at the Kohler Rehabilitation and Nursing Care Center on Roosevelt Island since he contracted a rare pulmonary disease. The center is a city-run, long-term care facility with 500 residents.
The island was basically built for people like us. There's like a whole bunch of like walkways and roads built for people with wheelchairs. And we are next to the water, so we can basically park by the water and just enjoy, a sunny day.
That serenity was disrupted last year when Molina, who'd been incarcerated on charges for intent to sell drugs 15 years ago, says a year-long lockdown at Kohler was like a flashback.
They put us on quarantine indefinitely, and they didn't let us come out at all. Because I've been in jail before, so it felt just like it.
Around the same time, the de Blasio administration sought to expand the number of hospital beds to meet the influx of COVID patients. The mayor said the city's public hospital system would transfer non-COVID patients into a wing of Kohler.
But then we started hearing rumors about patients with COVID-19 being brought over here.
The rumors turned out to be true. By April, many media outlets like the investigative nonprofit ProPublica reported COVID-19 patients were transferred into Kohler, and many long-term residents got sick. Molina says nurses informed him the sick from the COVID wing were dying.
They would tell us, 7 people died yesterday, 10 people died yesterday.
I started hearing reports in my community about a morgue truck or those big carriers, that there were 2 stationed outside of Kohler Hospital. And I thought, wow, that's super concerning.
Lynn Strong-Shinozaki, the Roosevelt Island chair for Community Board 8, started a Kohler task force when she caught wind of what was going on. The State Department of Health reported in May 2020 that nearly 40% of long-term residents at Kohler had tested positive for COVID. The death count has remained unclear, but Molina says about 15 Kohler residents he knew died from the virus. Several attempts to get a direct response from Kohler for this piece before deadlines were to no avail. However, this video from a virtual town hall last year shows Kohler CEO Robert Hughes telling Manhattan Borough President Gail Brewer 13 Kohler residents died from COVID.
There were many reports from residents and from advocates that there was not enough isolation of COVID patients. We all read in the papers, and you even got some national publicity that wasn't helpful, that patients COVID positive were placed in the same room as those with no symptoms.
From the beginning, we were following the federal and state guidelines.
Hughes denied the charges that COVID patients and residents shared rooms. He said practices evolved as guidelines changed. Strong-Shinozaki, though, has a different count of those who died. She estimates that between 30 and 40 Kohler residents may have died from COVID.
We just did the checks and balances at Kohler and said, wait a minute, if we had 500 and X amount of patients in October of 2019, and by May of 2020, we have 400 and blah, what happened to those other patients?
Months after the town hall, there were still allegations that Kohler wasn't following pandemic protocols. Residents organized a Nursing Home Lives Matter rally in December.
We just wanted to be treated like regular people.
Molina started a documentary project about the story called Fire Through Dry Grass. The city's health and hospital system maintains there's no negligence at Kohler. When we asked them for a statement on the matter, they referred us to this video on the mayor's briefings this year, where Health and Hospital CEO Mitchell Katz said efforts were made to protect Kohler residents.
Instead of returning patients who were sick to a nursing home, we used a completely separate building, right? And rather than return sick patients to Kohler, where they could infect other patients, we did construction on a completely separate part with a separate entrance, separate staff, separate elevators.
Strong-Shinozaki says the Community Board 8 joined a collective call to action for nursing home reform. In April, the state budget included long-term care reforms, such as mandating a higher percentage of revenue go directly to staffing and other patient needs. Shannon Ayala for DiverseCITY.
An organization advocating for the rights of disabled people on Roosevelt Island is celebrating a huge win in the midst of a controversy over the building of a memorial for President Franklin Delano Roosevelt, or FDR. We get the details in this report filed by Crystal Lowe.
The FDR Hope Memorial is scheduled to be unveiled this July after some major setbacks in negotiations between the Roosevelt Island Disabled Association, RITA, and the Roosevelt Island Operating Corporation. RITA originally took issue with the structure in 2009, when the four Freedom Park organizers initially proposed the idea of a statue for the former president. Advocates found the memorial's initial proposal problematic in that it failed to portray FDR in his actual likeness with a disability. Following his bout with polio, Franklin Delano Roosevelt was wheelchair-bound prior to and almost exclusively throughout his entire presidency.
It was important that we get President Roosevelt in a wheelchair because they didn't want to do that. That took a lot of fighting, but this is who he was, and this is what he accomplished in his life. And we have him reaching out to a girl on crutches, and it's a wonderful, beautiful statue.
The Roosevelt Island Disabled Association, or RITA, was created in 1985 in an effort to advocate for people living with disabilities.
We want people with disabilities to just feel part of our community. We do a lot of intergenerational things with the Girl Scouts, the Boy Scouts, the school, because we don't want to alienate our seniors and our disabled members.
Wendy Hirsch is the president of RITA and has been a Roosevelt Island resident for over 43 years. She says their services are increasingly important as the population on the island changes.
When I first came here, you saw people on flatbeds, people without limbs. We have hospitals on Roosevelt Island, and they were terminal rehab facilities. So it was a lot of getting used to. You know, my kids grew up around it, so they were more apt to be more sensitive to it. But we have a lot of new people now because the island has grown. A lot of foreigners come here. And it's almost like they don't care. You know, they're in their own little world. And that just depresses people when you can't say hello to someone because they're in a wheelchair.
Hirsch says the stigma that often follows people that have disabilities is one of the main reasons why RITA has fought so hard for the Hope Memorial to depict FDR in his authentic form. It's notable that Roosevelt did not want to be seen publicly in his wheelchair until much later on in his presidency. He would later become a symbol for the rights of the disabled. The memorial proposed in his name will be located in South Point Park. That's just south of the hospital where indigent patients with chronic illnesses, such as polio, the disease that disabled Roosevelt, were treated. Hirsch hopes that the memorial will help desensitize how visitors and newcomers see people with disabilities and challenge how we view and label people in the disabled community.
Able but not disabled, okay?
On July 26, 2021, the Americans with Disability Act, or ADA, turns 31. The ADA is a civil rights law that prohibits discrimination against individuals with disabilities in all areas of public life. Hirsch wants to celebrate the anniversary of the ADA with the unveiling of the FDR Hope Memorial. RITA wants to host a disability fair that will help connect members of the disabled communities with the resources they need to sustain their best quality of life. Crystal Lowe for DiverseCITY.
Before it became this somewhat bucolic retreat from the nearby city, Roosevelt Island was known for some grim tales that could make the plot of a Stephen King novel. Craig Thompson tells us more about some of this harrowing history.
Behind me is the lobby to a luxury rental here on Roosevelt Island called the Octagon. Its elegance now is a far desperate cry from what it once housed, and where medical mistreatment and chronic mismanagement were reported in the 19th century.
In the early to mid-19th century, New York City found itself in need of more space for criminals and the sick. So the city bought the 150-acre Blackwell's Island from the Blackwell family. The goal was to move the excess ill and indigent population from one island, Manhattan, to another.
It would be the most desirable place to put the prisoners, the lunatics, the ill, the indigent, and all the social people with social problems of the day.
A mental asylum, a workhouse, 2 prisons, and hospitals were built on the island by the mid-1850s, but almost immediately, problems arose.
But they were always overcrowded. Every single institution here was built for one group and ended up taking in 3 times as many people.
Author Stacey Horn combed through archival research for her book, Damnation Island. It's a harrowing account of life at the island's New York City Mental Health Hospital, also known as the Lunatic Asylum. There, according to Horn, the poor, the sick, and the criminal were all lumped together by the city's administrators.
So the mentally ill should be feared, and the poor people were essentially thieves in disguise and not worthy of our compassion, and that they all were guilty of something or other, and should be all together and away from the rest of us.
What was worse, she says, was that the prisoners from the workhouse were used as nurses and attendants in the asylum.
So that went just about as well as you can imagine. And I just found countless cases of abuse, cases of actual murder, though maybe you could call it manslaughter, but people died at the hands of these nurses and attendants.
As Horn dug deeper into her meticulous research, she found other chilling examples of the horrid conditions at the asylum.
So they put a pregnant woman in a straitjacket in solitary, and she subsequently gave birth while in a straitjacket in solitary. That actually, at least, was that word of that got out, and it led to an 1880 big, investigation.
Charles Dickens, visiting in 1842, described the asylum this way.
Everything had a lounging, listless, madhouse air. The moping idiot, cowering down with his long disheveled hair, the gibbering maniac with his hideous laugh and pointed finger, the vacant eye, the fierce, wild face, they were all there in naked ugliness and horror.
In 1887, journalist Nellie Bly faked insanity and was committed to the asylum. Her expose was serialized in the New York World, Joseph Pulitzer's groundbreaking newspaper, and became a sensation.
She's always credited for, it led to all these reforms. So I looked into that, and what I found was just like everything else, no huge reforms.
There were similar horrific stories at the island's smallpox hospital, where an estimated 13,000 people died of the disease over the 20-year period when smallpox raged in New York City. The hospital is now a landmarked ruin.
But the smallpox hospital had the same social problems of all the institutions. It was overcrowded, understaffed. They didn't have professional staff. They did have some doctors and some people who really tried. But in general, it was, pretty sad.
In 1895, the state took over managing all the facilities. They closed some of the buildings and they moved the hospitals to Queens. But Blackwell's Island over that 50-year period remains a dark stain on New York's history.
But I'm sure at least half of them probably did not need to be there, but there was nowhere else to put them. And there was no social services per se. So you just put them in a convenient place and forgot about them.
For Diverse City, I'm Craig Thompson.
If New Yorkers know nothing else about Roosevelt Island, they know it has its own tram. Vanessa Monet filed this report about this famed mode of transportation to the island.
Gliding across the East River at 10 miles an hour and reaching a height of 230 feet is the Roosevelt Island Tramway, the first commuter cable car in North America. Used by both island residents and tourists alike, the tram is to Roosevelt Island what the Staten Island Ferry is to New York's Fifth Borough. This New York City icon wasn't originally meant to be permanent. The tram began operating in 1976 from its stop at 59th Street and 2nd Avenue in Manhattan as a temporary means of transportation while the subway tunnel connecting the two islands was being constructed. By the time the Roosevelt Island subway station opened in 1989, residents had become accustomed to the tramway and the city decided to keep it. These days, boarding the tram is as easy as swiping a Metro card. The tram is owned by the Roosevelt Island Operating Corporation. The RIOC is a state-sponsored organization created specifically to develop and maintain the island. They reported that between 2.6 and 2.7 million people rode the tram in 2016. Roughly 6,000 people ride the tram on any given day, of which it is estimated that 70% are residents and 30% are tourists. A 2010 upgrade to the tram made the cabins less susceptible to high winds. The upgrade also included the addition of a wireless retrieval system, a much-needed improvement after the tram notably stalled over the East River for several hours in 2006. The modernization extended the system's life by an estimated 30 years. keeping the city's most unique form of public transportation running for future generations of New Yorkers. For Diverse City, I'm Vanessa Monet.
Finally from us, Roosevelt Island's pneumatic trash disposal system is one of a handful in the country. It's a source of great pride to the Department of Sanitation that runs the facility, and an environmentally friendly alternative that will soon be making its way to other parts of the city.
The designers of Roosevelt Island were not initially thinking about trash, they were thinking about removing cars, and it was the engineers who were tasked with figuring out how to develop the infrastructure for this new community that realized that another way of managing trash would be beneficial.
What those engineers came up with nearly 50 years ago was an intricate system of 2 miles of underground tubes, 30 valves, and one centralized automatic vacuum-assisted collection system, or AVAC. It's powered by several turbines. Yes, I know, that's a lot of numbers. But think of it like your vacuum cleaner picking up dirt. Except it's a giant vacuum cleaner that serves 20 buildings on the island today.
The building itself sometimes has 2 chutes per floor. A resident would come out of its facility with, household trash. They put it into the chute. It is sent down to the main floor, where we end up 4 times per day, operate the vacuum. The vacuum is all started up. When the trash is there, the valve gets opened up and is basically brought back to the facility. We've been told that vacuum can bring back a car battery at 65 miles an hour through the actual piping itself.
That's the speed limit in most states. The system isn't equipped for recycling, only trash. As the trash goes through the maze of pipes, it is separated, compacted, and then trucked off the island.
We basically pull approximately 40 tons of trash per week off of the island itself.
More than just moving a lot of trash quickly, the system also has environmental benefits. Juliet Spiritus has worked in sustainable waste management for years. She created an exhibit called Fast Trash that focused on Roosevelt Island's pneumatic trash disposal.
Basically uses centrifugal force to send the heavy stuff down.
She says that the underground system lowers noise and air pollution caused by garbage trucks and eliminates contact with disease vectors such as rats.
It's almost like you think of a sewer, right? And how we're really happy that we manage our sewer, our wastewater through pipes, right? And for many of those same reasons, if we can manage our solid waste outside of the public realm, that we can get those benefits.
There are even more benefits now that a recent upgrade to the AVAC has made the system more energy efficient.
The initial surge, as we call it, has been diminished down to almost nothing. And that's really where the big impact is. When you're going to start up a large motor like that, it uses almost 3 times the amount of energy that you normally would use just to get it up to speed. So under the pretense that this is basically what we'll call a soft start, it goes from down to nothing.
Even with all those efficiencies, things are bound to go wrong with all that trash tumbling through those tubes.
Every so often you'll get someone that'll end up taking some carpeting, and they'll, if it fits in the chute, they close their eyes and it's gone, rather than giving it to the maintenance people. So you end up getting a possibility from time to time where all of a sudden what we call is a jam.
That's when manpower is required in a mostly automated system. That means going into manholes to look for the obstruction, or using an instrument called an auger, which is like a combination of a jackhammer and a giant snake that a plumber would use on household pipes. Even when that happens, the system is still lauded as one of the best means of trash disposal available. So why is it only used in Disney World and on a smaller scale in one area in Jersey City? Spiritus says one reason is price, and another is that previous administrations were happy with the old ways of disposing of trash. But that's changing.
I think we will see more, and we are seeing more of a recognition that we have to plan waste infrastructure. We can't just rely on a kind of ad hoc system of bags and trucks.
Spiritus says plans are already afoot to have a similar system implemented at a nature complex called the Polo Grounds in Harlem. In the meantime, Carrick and his team are proud to be running the only pneumatic system in the city.
You know, when I drive onto the island, it's actually, you know, you can stick your chest out. The facility's working. It's keeping almost 14,000 people happy on the island itself. So yeah, it's as far as I'm concerned, it's a large source of pride for me to keep the place operating.
That's our look at Roosevelt Island. Join us next month for our summer special episode. Till then, thanks for joining us as we explore our diverse city.